we're about to step into a public health hurricane of a sort we haven't really had to deal with up until this point in human history, and I bet you've started to see hints of this happening already. I'm a scientist, and I also make content about health and nutrition, and I'm sort of morbidly curious about what's going to happen next. You see, the core problem is that we are no longer in control of the content that we see online. It used to be true that you could choose who you subscribe to, who you follow, and that would kind of determine the content that you would see the next day. But these days, almost everything you see is determined algorithmically, based on how you've interacted with other content, and that's true for entertainment content. It's also true for videos with health and medical information, and I'm going to give you an example of why that's pretty concerning. You see, if you ask people, if you say, do you want to see clickbait? Do you want to see emotionally charged negative content? Most of the time, people are going to tell you no. However, when that type of content shows up on your feed, you're manipulated by human psychology into watching it, or at least watching most of it. It's like you can't look away from a traffic accident, even though you know you should. And that unfortunately then tells the algorithm, guess what? All right, they're watching this stuff. We should show them more of this stuff because it's keeping their eyes on the screen for longer. We can show them more ads, which of course leads to a vicious cycle of doom scrolling, rage baiting, increasingly polarized opinions online, and massive revenue for YouTube, for TikTok, for Facebook, for Instagram, for Twitter, for all the others. Now, one study of the relative spread of misinformation versus true information, found that misinformation spread more than 6 times faster than true information and was 70% more likely to be shared. That particular study was specific to Twitter, but similar work has held true across other platforms. And because of the fact that negative or sensational content is much, much more likely to go viral, what we're facing is a skewed representation of health information online. I'll give you an example of how this can very, very quickly become scary for public health. Imagine 2 videos about a type of contraception, about a type of birth control. In the first video, someone describes how their experience getting it was the most painful thing they've ever experienced. They thought their doctor was creepy, they didn't trust them, and they still got pregnant the next month. Which all could be 100% true for that person. They made a video, no problem with that fact. However, in the second video, maybe someone says they had some mild discomfort that got better after a few days, they like and trusted their doctor, and they have not unintentionally gotten pregnant. That first video is basically guaranteed to go much more viral than that second one. Like, even though the patient experiences here are equal 1-to-1, the videos are not going to be shown equally on social media platforms in a 1-to-1 ratio. If I were to guess, it would be more like 1,000-to-1 in terms of video performance, if not more drastic than that. And if you imagine young teenagers who may be getting a lot of their contraceptive and sexual health education from what they happen to see online, from what is algorithmically served to them online, this could easily, and honestly very understandably, result in hesitancy about certain forms of contraception that, objectively speaking, like based on the actual published data, have a much better benefit-risk ratio than would be represented by viral social media content. Right now, about 50% of pregnancies are unintended, and we wouldn't want that number to go in the wrong direction just because social media companies are trying to maximize their profits. Now, of course, that's just one example. You can imagine the same principle of what types of videos on a given subject get more impressions. This could be relevant for many medical topics, ultimately leading to things like decreased utilization of meds for heart disease, cholesterol, blood pressure, routine immunizations, and the list goes on. Instead of making personal health decisions based on medical evidence, we may start to make decisions based on what goes viral on social media. How many people could this affect? A study from March 2024 conducted by the Pew Research Center found that around 82 to 92% of social media users see news-related content on social media, and younger adults had even higher stats than that. So the answer is that pretty much everyone who is online will be affected to some degree, and I think to an increasing degree over time due to the lowering barriers to content production with AI-generated video content. Given the recent growing distrust in big medical organizations in the US like the CDC, the NIH, the FDA, and others, I think the public health impact of health content online is going to be greater than ever before. And I don't think that's a good thing, but the question is, what is there to do about this? One step in the right direction would be for as many qualified experts as possible to start producing content for social media, hopefully to act as a counterbalance to all the pseudo-experts trying to sell you supplements and detox programs and whatnot. The question is, how do you incentivize people to take time away from their schedules to do so? Making content takes a lot of time. Now, in an ideal world, the actual CDC and the NIH and so on would get good at making engaging, fact-based content that feels entertaining to watch, but realistically, I don't see that happening anytime soon. So, I'm conducting an experiment here on YouTube. I'm producing long-form health content to try to provide direct access to fact-checked info from a scientist with a PhD, and I'm going to see how it performs. In fact, I've already recorded a few videos on topics like, are microplastics a risk for your health? And what can you do to reduce your exposure to microplastics? What does the research actually say about which lifestyle factors increase or decrease your risk of cancer? Do certain supplements, like vitamin C for example, actually help prevent the common cold, or do they do nothing? What are the pros and cons of, various diets that are popular on social media? So you are here on day 1 of this experiment. We'll see how it plays out.